All right. Good morning, everyone. Gavin here from Chinese Medicine Education and China Books Sydney. Today I'm joined with Henry McCann. It's his Sunday evening, so thank you, Henry, for taking the time out to be with us today. For those of you who don't know Henry, he is the go-to guy for learning Tung's acupuncture. But I think one of the really valuable things with having Henry is that rare combination of not only being like a accomplished practitioner, but also a very good teacher. And every time he teaches, the feedback is just amazing at like how well he's able to convey that knowledge to us. So I really appreciate having Henry come and teach with us. Just a few little housekeeping things. So during the presentation, if you have any questions or anything, please just pop them into the chat box or save them up at the end. We'll have like a little bit of time for a Q&A, but please, questions are welcome. We're also hosting Henry next February. If you're interested in coming and learning with Henry live, which I highly recommend you do if you can make that work in your schedule. So we'll be hosting Henry for 2 workshops, and there is a discount for coming to both workshops combined, but you can do one or the other. So that will be Friday the 6th of February to Monday the 9th of February. We've called it the Tung's Clinical Fast Track for the whole thing. But the first 2-day workshop will be all around, and I'll let Henry go into a little bit more detail. It will be all around understanding like the theory of Tung's acupuncture, but how to use that for the points we already know and love from like our TCM education. So for those people who might be a little bit intimidated by learning all the Tung's extra points, you don't have to worry about that, but you can still get the benefit of learning the system and applying those things to the points you already know. And then the second workshop, and this will be something that we'll be going a little bit more into in this presentation, is Tung's acupuncture combined with external herbal therapy to help with pain and injuries. And I think external herbs is something that we really could do with a little bit more education on. So I'm really excited to have Henry share a little bit today and then again in February. And I'll pop in the chat box a link to more details on those workshops, but I'll stop chatting and hand it over to you, Henry. Thank you.
Great. Good morning, everyone. It's really nice to be here. We're in a rather gray, very blustery Friday evening where a nor'easter is coming through town, which is a big rain event. So it's actually more pleasant to be here with you all than just about anywhere else right now. Today, what I thought we would do for the next hour or so is go over some just general information, but then look at it through the lens of a specific case study. And this is a recent case study. So oftentimes I try as best as I can to take recent case studies from my clinic to bring them into teaching. And this case study is very recent, only in the last like 6 weeks or so is the first time this patient came in. So it's, I think, a good introduction. It's a relatively simple case study, which I think is also a good way to start. But was one in the clinic where I did a combination of acupuncture with some external herbal therapy at the same time. So we'll talk a bit about Tung's acupuncture. We'll look at the case study's specific points and strategies used. Then we'll also look at, in general, the application of topical herbal medicine and herbal medicine in general in the treatment of pain, injury, and specifically like injury management, and how do we conceive of various different types of staging of injuries and what types of formulas may be appropriate at any given time period, as much as we can cover it in an hour. So this is going to just be a brief introduction. Before we delve into the case study, I'm curious how many, and you can type into the chat room, how many of you are completely new to Tung's acupuncture? I see some names that I think that I met last year when we were there, but any of you are just completely brand new to Tung's acupuncture? Okay, so not too many of you, which is good. So I won't go into too much. I won't go into too much depth in terms of Tung's acupuncture, but we'll just get started and we'll see where the spirit moves us as we go through. Okay, so I'm going to put the presentation up. Gavin, I sent you the PDF. I don't know if you want to distribute the PDF at some point later so people can have a copy of the presentation. All right, so let's just go ahead and do that. Okay, so let's just go ahead and start. We're not going to go into too much of the background, but just so you all have an idea of where the acupuncture system is coming from. So Dong's acupuncture was originally a family system of acupuncture that was essentially kept within the family, which was not an uncommon sort of social phenomenon in Chinese history and culture. And the person we call Master Dong, who people have probably heard the name at least, is this person here who was born in the early part of the 20th century in mainland China in Shandong province, who later learned acupuncture from his father growing up and then moved to Taiwan after the Maoist takeover of mainland China in the late 1940s. He lived in Taiwan till the end of his life in the 1970s, and at some point broke with family tradition and started teaching his acupuncture system outside of the family for the first time. And that sort of precipitated a book being written and then another book being written, and his training a number of students, most of which stayed in Taiwan, most of who stayed in Taiwan, but some of which went outside of Taiwan to keep teaching the system. Okay, what's particularly interesting about the system are a couple of things, and this is where most people sort of at least have a vague understanding of Dong's system. First, of course, is that there's an entire set of other points that he worked with that were his family acupuncture points. Now, clearly, the human body is only so many, there are only so many places we can stick a needle. So inevitably, there's going to be some overlap between conventional acupuncture points and TCM points. Now, sometimes when there's an overlap, the point usage is similar to how we would use it in TCM. And I'll say TCM just to represent all other types of acupuncture with no disrespect or prejudice against Japanese variants, Chinese variants, Korean variants. I'll just say TCM acupuncture to mean the regular 12 channels that most of us study in school. Right, so his acupuncture points sometimes overlap, and when they overlap, sometimes they have similar function. Right, so there's a point on the forearm that overlaps Sanjiao 6. Master Dong used it for constipation, just like we do use it for constipation in TCM. Right, sometimes the point usage is somewhat distinct in terms of its usage, but regardless, I'm going to argue that there are many times we can understand the usage. Just because Dong uses it for one thing and TCM uses it for another thing doesn't necessarily mean that we can't sort of understand and rationalize both sets, which is one of the things we'll be covering when we do that class in February on specifically how are we using conventional TCM points through a lens of Dong's acupuncture. And when we do that class, what's particularly interesting and why this is a class I've taught a few times recently, why I really enjoy it, is because we can use the theories of Dong's acupuncture to sort of simplify and understand the application of conventional acupuncture points in the use that might be not so obvious based on the common usage, right? So why are we going to see, for example, spleen 9 as being able not only to drain damp, which we learn, but also to treat things like enuresis, frequent urination, right? So we're going to be able to hopefully try to use a theory to understand the broader effects of acupuncture points and sometimes the less commonly used effects of acupuncture points, right? So, but we'll come back to that. So that's one thing that's sort of unique about Dong's system, or what's obvious, is first the extra points. The second thing that's particularly interesting about Dong's system is that there is an almost exclusive, not 100%, but an almost exclusive use of distant point needling. In other words, we tend not to needle in the site of disease. So, and we'll talk a bit about that as we go through the rest of the presentation. Another thing that's very interesting about Dong's system and very characteristic is a use of minimal needling in the treatment of disease, even chronic, recalcitrant, really complicated conditions. So what we can see is that the application of needles with a small number of needles can treat both, for example, root and branch simultaneously to good effect without necessarily having to resort to a lot of needles. So if you like a lot of needles, that's fine. But if you think you need a lot of needles to get good effect, that's simply an erroneous thought pattern, right? And we know that because most of the medical classics throughout history don't say low back pain use these 20 points. They say low back pain use these 3 points, right? So Master Tung was well known for using fewer, most of the time, 6 or fewer points, or 6 or fewer needles, I'll say, in treatment. And that's not 6 points bilaterally, that's 12 needles, that's cheating, right? So literally a small number of needles. And in this case, you'll see here, we used a very small number of needles to treat the case rather effectively and rather quickly. Okay, so let's go on from the background. We can talk more background in February. So let's just go ahead and start with the case. What I'm going to do is just give you the case. We're going to talk a little bit, come back to the case, think about it a little more, talk a little more, then come back and look at the specific treatment. So this was a 60-year-old female, presented again fairly recently with a new recent onset acute pain and swelling in the left elbow with a suggested diagnosis of lateral epicondylitis. So the diagnosis, I believe, came from, might have been a PA, a physician assistant. I don't know if you have such creatures in Australia, but it was a medical professional, was not an orthopedist, was not a physical therapist. However, when I saw her, I could not confirm the diagnosis by physical examination. So for example, she had no pain on resisted wrist extension, right? So there was no real sort of potential irritation in those extensor muscles. However, there was significant swelling. There wasn't a lot of redness, but there was a lot of heat on palpation, basically over this part of her left arm. What's interesting is she had previously had a fracture in the area. So it was a fracture of the ulna and sort of a fracture going down into the olecranon. I don't remember exactly. There were a number of places that were fractured, so much so that she had surgery and a placement of a surgical plate to repair the fracture. The surgical and this was several years before this, so that was not the recent injury. Several years before this, the surgical scar was still visible, but again at this point, and she didn't remember specifically an injury. It was probably something minor that she did that irritated the area. So there was swelling, there was significant heat on palpation, and there was a constant stiffness and dull ache. Worse with pressure, but not necessarily worse with wrist extension, right? So that just gives you the clinical vignette. By the time she had seen me, this had already been going on for several weeks without really change. And what I said is, we'll start treatment. If we get if we have a good outcome, then we have a good outcome. And if it doesn't feel better in a few weeks, then what I'd suggested is she go back and have a consult again with her orthopedist to see if there was a problem with the hardware that was placed surgically after the initial fracture. Okay, so that gives us the context. Let me just see.
Henry, we just had a quick little question. Was the heat over the top of where the plate was?
So there was a scar that was right about, it was almost sort of along the ridge of the ulna, right? I don't know, maybe, I'm metric impaired, so I have to give it to you in inches, maybe 3 or 4 inches in length. The scar was well healed. The plate was, I could palpate the edge of the plate, but it was sort of like, what's this word? It was along basically the sagittal plane of the arm, right? So the heat was in the entire arm, right? So this whole area, so both above the scar and going up into the sort of like the extensor muscles on the top of the arm, right? That was the general location of the heat. Again, it was far enough away from the surgery. I didn't suspect, or no one suspected, that it was an infection of the surgical site, because surgery was significantly before this happened. And again, there's not a specific injury that she could remember, but so that was the recommendation. We start treatment, and then we basically wait and see if there was, if it really didn't get fixed, because I've had patients with surgical implants before that needed revision because something went wrong with them, there was the wrong size, or you name it. So that was the suggestion. We were going to treat and then reevaluate based on response. Okay, so let's go on to the next slide. So first of all, so those of you who've taken classes with me know that I like theory more than the next guy. So first thing I'm going to suggest is that Tung's acupuncture is ultimately extremely practical, right? The application, once you understand the theory, the application is relatively straightforward. It's very practical in the clinic. I've been using it for well over 20 years at this point on a pretty much daily basis. But the background that it comes from is an expression of some very profound principles that we see within the Chinese medical tradition, within the contemplative traditions, that relates to sort of Taoist and pre-Taoist theory. And one of the basic theories that we see within Tung's acupuncture that sort of really describes acupuncture as a whole, and what I'm going to do in February is explain how this theory applies to all acupuncture points, because if it applies to Tung's acupuncture, it applies to all acupuncture points. And that is the interconnectedness between humans and everything else around us. So this is a quote that comes from the 70, so when you see LS, that means Ling Shu. LS 71 is 71st chapter of the Ling Shu. If you see SW in my writings, it would be Suen. I don't think I have any quotes in here from the Nanjing, but in my notation, you'll see like NJ and a number gives you the Nanjing chapter. So this is 71st chapter of the Suen. It says, heaven is round, the earth is rectangular. Humans' heads are round and their feet are rectangular, and thus they are in resonance. Heaven has sun and moon, humans have 2 eyes, earth has 9 regions, humans have 9 orifices. Heaven has wind and rain, humans have joy and anger. Heaven has thunder and lightning, humans have the sound of their voice. Heaven has 4 seasons, humans have the 4 limbs. These are the correspondences, in other words, the resonances of humans to heaven and earth. Right? And for those of you who can read it, I gave you the original passage, so you can take a look at that for those of you who want that. It's in the handout. What you'll see here on the slide, this character in blue, this character is the character ing, which I will translate as correspondence or resonance. And here we have the definition of this character ing from the Shuangjiezi, which is a very early dictionary of Chinese language that goes back to the Han period. So it's about 2,000 years ago. So when we're looking at early classical medical texts, we can actually go back to the how we define these words in the time period when these texts were being written. So the definition of this character ing means to sort of act as, to sort of match equally. This is the character ing that we sometimes translate as mirroring and imaging, right? In sort of more modern terms, for example, if any of you have looked at balanced method acupuncture. So mirroring and imaging, it really is this character ing. So this is, when it says we are in resonance, there's this resonance between heaven and earth and humans, it's as if we're this mirror image of. And if we look at this quote here, this is from the Lei Jing, the classic of Lei is like categories. So this is by Zhang Jiebing, and he basically writes a commentary on each of these lines. And the commentary that he gives us for this last line of this chapter is, he says that the Renshen, the human body, is a Xiao Tiandi. So the human body is a small heaven and earth, right? The reason that we have 5 phases in my body is because there are 5 phases in the natural world. Right? The reason that I have the Zang organs in my body is because they mimic something else in the natural world. And interestingly, even in the Chinese context, this not only goes to the natural world, but because the Chinese body politic in ancient times is supposed to be a something that mimics the Parthenon, right? So the reason that we have a certain structure of government in ancient China is because it matches the structure of those beings that inhabit the heavens. Likewise, the human body is structured as a body politic. So we have chapters like Suen 8 in the Suen, the Linglan Mi Dianlun, the secret treatise on the numinous orchid, right? Which is the chapter that gives us the quote. It says, for example, the heart is the sovereign. The heart is the enlightened ruler. The lung is the prime minister. The liver is the general of the army. So even the organs of the body can be seen as a sort of government structure. So all of these resonances between the natural world, between the body politic, between the human body, is something that is very real and really at the heart of how we can analyze medicine and then learn how to apply it very practically in the clinic. I mean, because that's what it comes down to. As much as I love the philosophy, and many of you here probably enjoy the philosophy as well, if the philosophy doesn't have application, this is the idea of Qi and Yang, of sort of theory and application in Chinese medicine. If it doesn't have an application, who cares, right? So all of this very interesting theory does come down to very practical uses. So for example, let me advance this, if I can find my cursor. So here, of course, the Neijing Tu, this is the diagram of the inner landscape. Many of you, this is an if you know kind of diagram. Many of you have seen this diagram before. It's the whole human body, and this is the whole human body as this mythical landscape. This is used in the context of things like meditative practices or modern Qigong practices, but it's the same in medicine. The human body is this landscape. So we have this idea that's very, very deeply enmeshed in traditional Chinese culture that human beings are in connection with heaven and earth. So Tian Di Ren He, heaven, earth, and humans are in harmony. There's this connection, which means we're a microcosm of the natural world. And if we understand this theory that what is above, as above, so below, then even in the body, we have microsystems after microsystem after microsystem. If my body is a microsystem of the universe in the natural world, then it stands to reason that small parts of my body are also microsystems of me as the whole and the whole universe. For example, we've decided in Chinese medicine, and the Nanjing goes into detail to explain why this is, but we've decided in Chinese medicine that many of our diagnostic techniques are using one small part of the body to represent the whole. For example, pulse diagnosis, we can feel the condition of the entire body through one small segment of the lung channel, right? And the Nanjing gives us a number of chapters that describes why. When we do tongue diagnosis, we can see the entire body through looking at the tongue. In Tung's acupuncture, one of his main diagnostic methods was palm diagnosis, where the entire palm is an image of the whole. So the meaning of a hologram is that if we cut a hologram into smaller and smaller pieces, it still retains the image of the whole thing within the small piece. Get the idea? This, in many ways, is why acupuncture, I would say, I'm not even going to say for most points, for every point, this is why acupuncture sometimes does what it does in ways that are maybe not as obvious as the pain is here, put the needle here, right? That's easy. I tell my patients, if you just put the needle where it hurts, just go, here's some needles, go home, stick yourself where it hurts. It's very easy. Just go ahead and take care of it. I had one patient come in just a couple years ago, and he had neck pain, and I put in spleen 6, and in a few minutes, you'll be able to tell me why I put in spleen 6. And I put in spleen 6, and I just did a little very low stimulation, because again, I don't believe, I'll just say De Qi is not what you've been told De Qi is, and I can quote the Neijing to tell you it's not what it is, and maybe we can talk about that in February also. So I put the needle in, I said, okay, move your neck, and he's like, oh, it's starting to feel better, and he's doing this, and he says, what do you call that? And I said, what do you mean? What do you mean, what do you call that? He's like, what you're doing, what do you call that? And I said, it's called acupuncture. And he says, no, I mean, like when you put the needle there instead of putting the needle here. And I said, well, it's just better acupuncture, right? And it was, I didn't have an idea of what he really is really asking. So because of this idea of microsystems, we can stimulate areas of disease without needling directly into the area that's problematic, right? So when we're choosing a distant point, which we know, and we'll do this real quick, the idea of distant point needling is not new. It is not something that is foreign to, if you look at acupuncture point indications, it is not at all foreign to how Chinese medicine and acupuncture fundamentally works. And we can see that even going back to the Neijing. So here is SW5, again, is Su in chapter 5. It says, hence those who know well how to use the needles, right? So basically the superior acupuncturist From the yin, they pull the yang. From the yang, they pull the yin. With the right, they treat the left. And with the left, they treat the right. So right there in the foundational text, chapter 5, early on, it says this is what acupuncturists do. You don't have to put the needle where it is. In the chapter on the Suen, I think it's chapter number 39. I'd have to look up the numbers. Someone can check the chapter number for me later. The chapter that's on treating low back pain, it gives us several different types of low back pain, but not a single time does it recommend local needling. All of the treatments given in the entire chapter on how to treat back pain in the Neijing are all distant point needles. Okay, so it's not something particularly new. The reason distal point needling works, one of the mechanisms it works, is because of this idea of microsystem. Just as we can feel the spleen here, we can treat the spleen not by going to the abdomen. Get it? Everyone get that basic concept? So let's go back to the case of arm pain. First thing we have to do is we have to understand what essentially the diagnosis is. All treatment flows from an appropriate diagnostic understanding of the case, right? So here we have the case again. So it's a 60-year-old female. I gave you the case. First thing we have to ask if we're looking at acupuncture is what either channels or organs are potentially involved in the case. And if we're looking at organ involvement, then that translates into what channels can we potentially treat as well. Since the medium that we work with, right? Let's say you're a famous artist and you're good with like paint, you do oils on canvas. No one's going to ask you to carve a marble statue, hopefully, because it's not going to work so well, right? The medium you work with is brush, oil, and canvas. If you're a master carver and you're going to carve something, you're not going to carve something with brush and ink. Get the idea? If you're an acupuncturist, the medium that we work with are the needles and the channels, because what we're putting the needles into are channels or other structures directly influenced by channels. So that's the medium we're working with. That's the diagnosis we have to understand. Even if it's a Zangfu diagnosis, we still have to translate that into what channels does that mean we needle. So here we have to identify the location of the disease. First thing, and this is, I'm just telling you this based on my own, really looking at the pattern of pain. So for her, the primary channels that were involved were where the most pain was when I palpated and I saw what areas were tender. The two most painful channels in this case were the arm yang meng and the arm tai yang. There was probably some sanjiao, xiaoyang involvement as well, because it's in between there. But the most pain were the arm yang meng and the arm tai yang. We also know there was heat and stasis in the area. Heat, because we could palpate it. Stasis, because there's pain, right? In Chinese, bu tong zi tong. If something doesn't move, there's pain. That's a sort of a statement of fact in Chinese medicine. So the primary diagnosis is stasis and heat in the yang ming. That was the most painful channel. And then the tai yang is a secondary channel, right? And we could say there had to probably be something in the sanjiao in between. Get the idea? That's our diagnosis. Now that we have a diagnosis, we can move to, so if those are the channels that are diseased, then we can move to what channels do we treat, and then what points on those channels do we treat. So the algorithm in acupuncture, and I'm going to argue this is, for pain-related cases, is the same as Dong's acupuncture and TCM acupuncture, is where is the channel that is diseased, then we choose a channel for treatment. We can needle the same channel, it's fine. You can needle other channels, it's fine as well. After we know the channel of treatment, then we think of acupuncture points, right? We just like in herbal medicine, you have li fa fang yao, you have theory, method, formula, single herbs. You don't go right to single herbs. You say, what's the diagnosis? what's the treatment principle, what's the main formula, and then we choose single herbs. In acupuncture, we go from what's the channel that's diseased, what channel do we use for treatment, and then what points do we choose on that channel. That's the sort of end point. Get the idea? All right, let's go on. So how do we look at this? We have to look at this idea of gan ing. So this is connection, resonance. Gan ing also means stimulus and response. So if we're not needling in the local area, we have to choose a channel of the body and an area of the body that's going to get the therapeutic stimulus to the site of disease, right? If we know the disease is here, the bu tong zi tong, the not movement is here, what part of the body can we apply the needles to so that the stimulus gets the qi and blood moving here so it gets better? Get the idea? So one of the ways we do this is through looking at this microsystem in the body of how one part of the body relates to another part of the body. This, by the way, for those of you who practice internal martial arts, whether it be Bagua, Xingyi, or Taiji Chuan, this is the same as the theory in martial arts that we call the 6 harmonies. We have the San Wai He, the 3 external harmonies, and the San Nei He, the 3 internal harmonies. This is the 3 external harmonies. So and this is the same as in balance method. So balance method takes this theory that was sort of talked about first in Dong's acupuncture. It's not unique to Dong's acupuncture. It's been around for a long time before anyone talked about Dong's acupuncture. And this is one of the ways we can apply choosing areas of the body that have resonance to one another. So here we can see, for example, very simply put, the hand goes to the head, the foot goes to the head. That's the outer diagrams. The elbows and the knee go to the midsection. The shoulder and the hips go to the lower trunk, but also the hand goes to the foot, the elbow goes to the knee. So for example, if you open up Deadman's book on acupuncture points and look under lung 5, you will see that lung 5 treats pain of the knee. This is not unique to Dong's acupuncture. We see this in TCM. It's just a strategy of treatment that's used more frequently in Dong's acupuncture, but it's not unique to Dong's acupuncture. Likewise, if you open up Deadman, I promise you go check it out later tonight if you want, or this morning for you. Under lung 5 in Deadman, it also says it treats low back pain. Why? Because the elbow region treats the level of the navel, right? Front and back, around the trunk. Lots of points we use to treat headache are on the hands, large intestine 4. Headache points are on the feet, liver 3, right? So both large intestine 4, liver 3 treat the head because there is a specific resonance right there in correspondence between the hand and the head. So what is a distant point? And stop saying distal point needling because distal means away from the trunk. It's a specific anatomic direction. What is a distant point? A distant point is nothing more than a local point needled somewhere else. Get that? I'll say it again. A distant point is nothing more than a local point needled somewhere else. So if I need to treat the low back, I have to choose a point that is has a correspondent resonance, is a mirror, a representative of the low back. So bladder 40, right? Bladder 40, one of the quintessential low back pain points of all low back pain points. It's located on the back of the knee, which we see goes to the level of the navel, right? Likewise, bladder 60 for neck pain, the ankle region images and mirrors the area of the neck. Get the idea? So this is one of the ways we can choose location of treatment based on location of disease. Then we have to ask, how do the channels relate to one another? One of the ways if we're not doing local needling, right, we have to choose a channel that has a resonance. And so this we can go over more in concept in February, this idea of Tong Qi Xiang Qiu. The same qi looks for itself. This is a quote from one of the commentaries on the first hexagram in the I Ching. I tell you, it all goes back to these foundational texts. So for example, we know in Chinese medicine that the channels are large channel systems. So when we're looking at the arm yang ming, which is why I didn't say large intestine channel by itself is the channel that's problematic. Why? Because the fact that it's a yang ming channel is oftentimes more important than its large intestine channel, especially as an acupuncturist. Okay, so here we know that the Taiyang channel system is just one channel system. The bladder and the small intestine are just different branches of the same family. So we all know in TCM, for example, small intestine 3 treats low back pain, right? It treats the spine. Not only because it's related to the Dumai, because that Dumai association is only a couple hundred years old, but for 2,000 years we've used it to treat the spine, even before we had an idea that was connected to the Dumai historically. So one of the ways we can look at the case is if we have pain on the Yangming channel here, then I can choose a point on the Yangming channel. Where on the Yangming channel, that's where we combine the channel with the location, right? And we'll see what point we chose in just a second. Now, this is a way that we can unite yang channels with yang channels, but we can also connect yin channels with yang channels, right? Because what did I say before? The superior acupuncturist treats yang from yin and yin from yang. So here, of course, this is only yang treats yang and yin treats yin. Not so exciting. So we also have ways of pairing channels based on, again, an understanding of what are these interconnections. This specific understanding is first articulated in the 6th chapter of the Suen, which we'll talk about more in February specifically. Now we can see that there's going to be a connection between the Taiyang layer and the Taiyin layer, the Xiaoyang and the Xiaoyin, and the Yangming and the Jueyin, which is another reason why we see herbs, for example, like Ma Huang. Who remembers where Ma Huang, what channels does Ma Huang enter? Anyone? Anyone? Quickly type it in the box. Ma Huang? Any herb teachers here? So since we're short on time, Ma Huang enters, so it's not really the Taiyang, right? It enters one of the Taiyang. Ma Huang enters the lung and the bladder channels, the Taiyang and the Taiyin. Why? Because they're both the exterior. One is the exterior of the yin level and one is the exterior of the yang level, right? But there's a connection there. We see famous point combinations coming in here. So for the 4 gates, the 4 gates is a combination of Yang Ming and Jue Yin, large intestine, arm Yang Ming, and liver, foot Jue Yin. Other famous point combinations, like for constipation, we needle Sanjiao 6, kidney 6, using Xiaoyang and Xiaoyin. So this is something else we'll be talking about in February, is how do we use these ideas not only to understand what points are doing, but how do we use these to understand effective point formulas or combinations of point. When we do acupuncture, it's not just throw random points in. My friend Robert Chu in California says, spray and pray. You just throw as many needles in as you can and hope something sticks. That's not good acupuncture. Good acupuncture is very mindful of not only what points am I using to treat the condition, but how am I combining those points in a way that amplifies the effect. So the 4 gates doesn't just do what 4 gates does because, they're not herbs. Large intestine 4 moves the qi and liver moves the qi. Yeah, sure. But the reason 4 gates does what it does is because not only are they 2 points that move the qi, they're 2 points in the same location of the body, one on the hand, one on the foot. And we know the hand and foot have a connection already, but they're on paired channels, right? They're on Yangming and Jueyin, which means those channels. So think about making a seating chart at a wedding. You can have 100 guests in the wedding, and the wedding can be great, or it can end up in a fist fight, depending on how you seat people at the table. So how you put acupuncture points together is how you seat them at the table to make it more effective, or maybe not quite as effective. Okay, that we'll talk about more later next year. So then the points we chose here, and this was a good case because the points here pretty much overlap conventional acupuncture points. On the opposite side, so the pain was on the left arm, on the opposite side we needled the upper 4 flowers, which is in the same location as Zusanli, stomach 36. And then we needled the Heavenly Emperor, which is in the same location as Yin Mound Spring, spleen 9. Okay, so 2 points, very straightforward. This was the main set of points. As an adjunct point, we needled Lingu, which is on the hand, same side, further down from large intestine 4, basically at the junction of the metacarpals. So let's think about now what these points did in the context, or how we how these points treated that area. First, both of these points are located in the vicinity of the knee, just distal to the knee, just as the area of most pain was just distal to the elbow. The point that overlaps stomach 36 is on the on the leg yang ming, which is in resonance with the arm yang ming. So the stomach channel we can use to treat the large intestine channel, which is why, for example, we have points in conventional acupuncture like leg 3 miles and arm 3 miles in an analogous location, right? Large intestine 10 is just down from the elbow. Small stomach 36 is just down from the knee. They're the same damn point. Just one is the version on the arm, one is the version on the leg, which is why we have overlapping functions of those points as well. Okay. So the other point we used was spleen 9, or a point in basically spleen 9. This treats, now this is where we can use a yin channel to treat a yang channel. Remember, if we go back here, the tai yin, which is the spleen channel, has a resonance with the arm, the leg tai yin with the arm tai yang, so we can use the spleen to treat the small intestine on the arm. Get the idea? So 2 points get both of those main channels, and then the last piece of it, which we don't have time to go into today, is that the spleen channel also treats the sanjiao channel. And we'll talk about why that's the case in February, because of another channel connection. Now, aside from all of that, let's just think about some of the other ramifications of choosing these points. So the main thing so we have the channel, we have the location, but the other thing that was there was heat, right? So now when we're needling stomach 36, and this is where we start bringing into the picture, which is why it's more than just balance method, we start bringing in a deep understanding of 5-phase relationships, which is essential to understand Tung's acupuncture and essential to understand conventional acupuncture. So what's the 5-phase relationship between stomach 36 and heat? That's the next question. To understand that, we have to understand what point is stomach 36, what 5-phase associations it has, and what that has in relationship to the area that's problematic. So stomach 36 is which point on the stomach channel? Anyone? Type it in the box. Gavin, we can put you on the spot also. I know it's early in Australia. So stomach 36 is the he point. Right, it's the he point. What's the 5-phase association of the he point? On the yang channel. So remember, the yin and the yang channels, the associations of the jinging, shujing, he points, the 5 shu points, 5 antique points, is different. On the yang channel, the he point is earth, right? Earth, soil. On the yin channels, that's for yang. On the yin channels, the he point is water. Okay? So the other thing we have is that so before you answer the other thing, what's the relationship between heat and, since we're doing stomach 36, so if we're starting with, what's the relationship between heat and earth? 5-phase relationship. Right. So earth is the child of fire, right? Earth is the child of fire. Remember from 69th chapter of the Nanjing, when there's deficiency, we supplement the mother, and when there's repletion or excess, we drain the child. So the earth point has a draining effect on heat, which is why many earth points in the body clear heat. The reason why large intestine 11 clears heat is not because it's shigao, it's not because it's an herb. Large intestine 11 clears heat because it's the earth point of the yang ming channel. So if we have full heat pattern, we drain Yangming heat through the earth of Yangming. Get the idea? That's why it does what it does. So if we have heat in the local tissue, we can also think of draining earth points, which is what stomach 36 is also functioning. So stomach 36 gets us to the location, stomach channel gets us to the channel, and we can use it to treat the heat in the local tissue even distally. Get the idea? We'll talk more about spleen 9 in, yeah, we could talk about this for hours. We'll talk more about spleen 9 in February, in addition to why spleen 9 gets to the channels here. Okay, so here's what we do. We put those 2 needles in, we have the person move the arm, right? Have them move the arm, stretch it a little bit, however movement they can do. And then we have them test pressure sensitivity. Pressure sensitivity goes down almost immediately once the needles are applied. Then we add in lingu on the same side to encourage movement of qi and blood in the local tissue. Okay? And even just with the acupuncture, the swelling actually is better by the end of the retention of 30, 40 minutes of needle time. Everyone happy so far? Very simple treatment, 3 needles, it's all you need. And then the last thing we did was we used some external herbs. So let's talk briefly about that. You can go back and read the location and the functions of these points a little bit later by yourself. So when we're looking at herbal medicine for pain or injury, one of the ways we can theorize and understand how we apply herbal medicine is by staging of injury in terms of timing of injury. Now, this is not always the case. We still have to evaluate what we actually see in the given patient, but generally speaking, we have early, mid, and late stage injury or pain. Early stage injury is usually characterized by swelling and pain. Oftentimes, heat is a byproduct of this. And so the main treatment methods here are to quicken the blood and transform stasis. A secondary method is to do things like clear heat if heat is present. And we can also either disperse, which basically means to scatter, or we treat by precipitation, 下法. Precipitation is downward method. So precipitation is specifically if there is injury to the abdomen or other parts of the trunk. So that's where we give people like dahuang, rhubarb, to create loose stools. My main traumatology teacher in Boston, Chinatown, was where I studied all this material, a lot of his patients would have diarrhea for a day or two after an acute injury because he always wanted them to move blood not only in the outside but on the inside as well. So he'd give them lots of dahuang, but he got really good results. So this is early stage treatment. Mid stage, things start to improve, but usually we still see stiffness, we see reduced range of motion. So here now the main strategies, we don't have to clear heat as much, we don't have to get rid of swelling as much, but we have to increase movement, we need to support healing of sinews and bones. So here the main treatment methods are harmonizing and joining. Joining means to basically repair tissues, right? Then third stage is after injuries. This is, most people, if it's a simple injury, don't ever get to third stage, right? This is maybe a patient who had impaired qi and blood to begin with. Maybe their body couldn't seek that homeostasis by themselves, or it was a significant injury or a fracture. So here we start having, there's still muscle cramping. This is where wind, cold, and damp can get in. It's the old injury to the knee from when you were younger, that every time the weather changes, the knee starts aching. So here we do more warming, scattering cold, relaxing the sinews and the network vessels or the law vessels. So the main treatment strategies here are supplementation and warming methods. Okay. So these are some of the strategies we use for early stage treatment. And even though there was in this case, even though there was a previous fracture and surgical treatment, this was still an early stage injury in that it presented with acute pain, swelling, heat, right? So we can categorize the exacerbation of whatever was going on there as an early stage injury. In this case, and so we can use these strategies for internal medicine, but in this case, rather than doing internal medicine, I opted to use an external application because it was relatively localized. I didn't think she needed to do anything internally, and we'll see it was very effective. So what we're going to talk about briefly are poultices, which are basically one method of external application where we're taking herbal material and making it into basically a paste that's applied topically to the area. So this is a photograph from my herb grinder in my clinic. Gavin, you'll have to see if you can find us an herb grinder somewhere for when I'm there in February so we can actually make this together. It's actually quite a lot of fun. So what happens is we take an herbal formula depending on the needs of the patient. In my clinic, I have several formulas that are pre-ground for use when needed, right? So I have an early stage injury formula, a mid-stage injury formula, a late-stage injury formula, and a fracture formula at the minimum all the time, depending on what the patient comes in with. So you can see the herbs are ground. This one, it's not completely ground. This is sort of a coarse grind. So we try to grind this to as fine a powder as possible. And then if we're making a poultice, then this has to be sifted so that we just get the powder and whatever sort of sharp stick-like pieces of it are actually taken out of the end product. Okay? After it's made into a powder, when we're applying it, we then take the powder, mix it with either some sort of liquid like an oil medium. My teacher, Dr. Chen in Boston, used to say some of his teachers, because they don't want to give all the secrets, but there are not that many secrets. If you're an herbalist, none of these formulas are very complicated. So they would sometimes take like a small container of liquid that was sort of dark color and tell the students that this is my secret ingredient. It was nothing more than just tea, leftover tea from the morning that just looked like something different. So there's no real secret ingredient. So we mix it either with a water-based medium. It can be mixed in with an oil base. Some people mix this in with a Vaseline or some petroleum jelly and then keep it shelf stable for a period of time. The oil-based products actually do absorb better, but then you have to make them in advance. So I typically use just hot water in the clinic. So what happens then is we apply the poultice, and in this case, we used a new injury poultice, which included herbs that have a blood-moving effect, a pain-relieving effect, but also a heat-clearing effect. So some of the herbs that go in this formula that we used, and we'll go over these formulas in depth in February, were huangbai, da huang, du huo, mu xiang, so some that move the qi. Baijiu, the Chinese angelica, is a very, very good pain-relieving herb. Yanhusuo, the corydalis, also a very good pain-relieving herb. So you can see, and you can see the other ones here. And then to help open the surface, I usually add a little bingqian, which is borneol, similar to camphor. So this powder then is mixed into a paste. We can see eventually what it looks like when it's applied topically. This was not this patient. This is a previous patient that had, you can see, a large hematoma. By the time this patient came to see me, this one in the photo, hematoma had been there for several weeks. This was she was in her late 70s, early 80s at the time. So it was a very bad fall. There was no fracture, but there was a lot of pain, swelling, and heat on palpation right at the hematoma. So you can see on the other side here there's this dark paste that we then apply and tape in place that then stays for a period of time. This hematoma, by the way, even though it had been there for several weeks in this patient, we'll talk about this case study in February, within a week and a half, the hematoma was gone and the pain was also gone. So what we did in this case that we're talking about with the arm is we took this poultice, a new injury poultice, made the paste, applied it topically, and it was taped to the arm. She went home with it for 6-7 hours. She left it on and then took it off and tossed it. What's interesting in this case, even though the pain had been there for some time already, for a couple of weeks by the time she came into me, during the needle treatment, the swelling itself had started already to go down. After the first application of the plaster, the pain went almost to zero. And that lasted for a good several days. By the time she came in for a second treatment, the pain had increased again slightly from the bottom level of pain, but had not returned to the original level of pain. And after the second treatment, which basically repeated the first treatment and the second application of the new injury poultice, the pain went away. And now we're 3 or 4 weeks later and the pain has not returned in the area of the forearm. So we're working on other stuff. So this is a relatively simple case, but it illustrates some essential core aspects of Dong's acupuncture with the application of an external herb. Now, one of the reasons why I do believe that the application of external herbs is very useful in the clinic, one is because it's easy to apply. Once you have formulas in hand, and none of the formulas are particularly, I've practiced martial arts longer than I've done medicine. I've done medicine for 26 years now. And I've had a lot of famous martial artists give me their secret formulas. And I can tell you without a doubt, not a single one of those formulas surprised me. If you're a professional herbalist, none of these formula constructions will surprise you. It's just there's certain herbs that are typically used topically, certain strategies that are used that might be slightly different. But in the end, once you get the idea, you can easily make up these formulas yourself. Or if you don't have one of the herbs in stock, you can come up with a substitute because you understand what it does in the formula. They're relatively easy to apply. Once you have the formulas, you can pre-make them to have them in the clinic, to have 2, 3, or 4 formulas ready to go anytime. They're well tolerated by patients. Once in a while, you'll have someone who has a skin reaction, but for the most part, they're fairly well tolerated by patients. You don't have to worry about interaction with medications they may be taking. So the concern of patients, I'm taking medicine, I don't want to take herbs. In other words, it's an easier sell to the patient than taking something internally. And they're super effective, right? They make the treatments much more effective, and I can't tell you how effective. I'll bring more photos when I come in February of different types of things that you'll see, and we'll talk about more cases. Also, if you run an acupuncture practice where it's hard to convince your patients to come in 3 or 4 times a week for an acute injury, this dramatically increases your efficacy in treating that patient successfully. So in the United States, one of the problems we have here, of course, is reimbursement for acupuncture services. So patients in my clinic, some patients have insurance coverage, but many of them pay out of pocket. So it's hard to convince them to come in as many times or the frequency that they need to come in. When we give them herbal medicine, whether it's internal or external, even for pain cases, right? So I think a lot of us think of TCM herbs as internal medicine for internal medicine cases, but herbs are as useful for external injury management as they are for internal medicine, whether you're talking ingested herbs or topical herbs. It dramatically, in my experience, makes your treatment more effective so the patient doesn't have to come 3 or 4 times a week. If they come once or maybe twice a week and use herbs, you can still treat them very effectively. And then you're going to have a patient for life. The worst thing is the person comes in, you say, okay, you got to come 2, 3 times a week. They come in once a week, and in 2 weeks they decide acupuncture doesn't work because they've had this pain for months, and in 2 visits spaced a week apart, the knee pain doesn't get any better, right? And then that patient doesn't come to see you, and acupuncture doesn't work for that patient. That same patient who can only come once a week, you give them herbs, then in 2 weeks they're going to feel better with a combination of the less frequent acupuncture and the herbs. So I think in a clinic, it's actually ultimately very practical to combine the use of herbs. And if you can go into external herbs, that then is a way of dealing with patients who may not tolerate or may not want internal herbs at the same time. Okay, I know that a lot of you have to get to work. Why don't we so that's just, again, a very brief and, again, very simple pain management case study. Hopefully it gives you an idea into sort of the thinking of both Dong's acupuncture and some of the use of herbs. I'll open the floor up to some questions if people have other questions before we adjourn for my evening. You can hear the bell tolling 6 here. All right, so any
So
questions?
if anyone has any questions, feel free to either pop it into the chat or unmute yourself and chime in. Just while we're waiting, do you want to, Henry, maybe just give like a little summary and synopsis of the 2 workshops that we will be covering in February?
So the one workshop essentially is going to take a look at the core theory of Dong's acupuncture, how we understand then, or how can we use the framework of both Dong's acupuncture and conventional TCM. Again, I'll just use TCM. I don't like to say the term because TCM is a specific thing. But theories of, for example, yin yang and 5 phases, and how we can use those to really start breaking down and understanding acupuncture point usage that is beyond just local use or beyond the simplistic memorization of point functions, right? So the first 2 days, and I think we're doing those 2 days first, I'm pretty sure we're doing those 2 days first, is really just looking at, so you don't have to memorize all the points in the book that are different. They're all points you already know, but how can we understand those points in a way that makes them more applicable to a wider range of conditions, and then delving into uses that might dovetail in with Tung's acupuncture without having to understand and memorize all these new point locations. Because one of the frustrations and one of the scary things about Tung's acupuncture is, listen, I wrote a book on it. There's lots of other points. And you're tired. I know a lot of people are tired of learning more points. I get it. And I fundamentally don't think that the basis of Tung's acupuncture and conventional acupuncture are different. If you truly understand yin yang, 5 phases, channel theory, organ theory, then you can understand Tung's acupuncture and conventional acupuncture. If you're good at the system of acupuncture you do, I don't care if you do Korean acupuncture, if you're really good at Korean acupuncture and you understand the inner mechanism, you should be able to look at a famous TCM doctor who gets good effect and say, I understand why that works. I may not think that that's the strategy I want to employ in my clinic, but I understand why that treatment worked. If you look at an acupuncture prescription and say, I have no idea why the hell that worked, I can't even understand why it worked, then it's not necessarily, you don't really understand acupuncture theory to that same level you should. Right? That's the first class. The second class, what we will do is looking at an overview of specifically Tung's acupuncture for pain and injury management combined with herbal medicine. In that class, we will discuss internal herbs. So the commonly used formulas that I like to look at for different areas of the body. We'll talk about staging of, like we did here, in more depth. We'll look at how we look at disease staging in terms of herbal medicine, and then look at various methods of external herbal medicine, including poultices. So we'll do formulas for poultices. We'll look at how to make liniments. We'll do formulas for liniments. I'll talk briefly about things like ointments. Ointment making is a messy prospect, so we're not going to make an ointment in person. And then we'll talk about ironing, what ironing is. It's not for clothes. It's another method of herbal application. And then how that goes. Let me see.
Yeah, so we've just got a little question that's popped through, kind of like a case study question there.
Yeah, so again, if it's a relatively new injury that's still hot and red, then the poultice, the herbal ingredients that we put up in the presentation is a good basic place to start. And if it has to come out, it has to come out, right? But that kind of herbal poultice would be potentially useful. If you don't have time to make a poultice, you could also get that same herbal formula, boil it, and use it as a soak, right? So we'll talk about soaking with herbs as well. So in my clinic, we do poultice, and it's a regular thing. We do poultices. I make people come in my office, and I have jars of liniments that are soaking. I like to try out different formulas. So for those of you who are not herbalists, then you would have to see what's commercially available in the Australian market. There are commercially available things in the US market that are out there. So you would have to see what's available, or maybe Chinese medicine education can go on to a new product line. You can talk about that with Georgina. If there is a wound that's an open wound, we typically don't use poultices on the open wound, especially because the poultice material is not going to be sterile, right? So I don't necessarily recommend using poultices. So for example, if you have an open fracture, we don't use poultices on the fracture until that surface is healed. If it's a closed fracture, you can wrap it. So that is a good question. If there's an open wound, then you do acupuncture. And the beautiful thing about acupuncture is we all know, hopefully by now, that you don't have to do local needling to get good effect. In my clinic, local needling happens once in a while, but maybe 1 out of 10 cases, maybe. And that's not when I'm doing Tung's acupuncture for the most part. Good. Those are some good questions. Any other questions before we call it a day? So here, swapping stomach 36 to LI11, if we're doing LI11 in the local area, then one of the problems is the patient can't move the arm, right? And what's pain in Chinese medicine? Tong's the tong. When there's no movement, there's pain. So one of the strategies for acute injury is I want the patient to move the area because acupuncture moves qi and blood and movement moves qi and blood. Got it? The poultice on a corresponding area, I have not really tried it. I do think that herbs and acupuncture are slightly different in function. I can tell you what I've experimented with is kinesiotaping in distant areas to treat a local area. I don't have enough data in my practice yet to tell you how well it works. So Gwen asking about large intestine on the opposite side. When we're doing opposite side upper limb, rather than using the same point, we have to choose what channel gets to here. So if it's large intestine channel, one of the ways we can pair large intestine channel on the arm are interior-exterior pairs, right? So what's paired with the large intestine on the arm is lung. Large intestine and lung are pairs. So instead of doing large intestine on the opposite side, we would do lung on the opposite side. So something like lung 5 on the opposite side could be used as well. Get the idea? Although what we don't get from lung 5 is the same heat clearing effect as stomach 36. Right? Stomach 36 as earth on earth has a stronger heat clearing effect, which is also an example of what we'll talk about in February. We think of stomach 36 as strengthen the qi and blood, which it does. But if you look at stomach 36, it also treats things like heart fire, it treats mania. Why does it treat mania? Because it's 5-phase association. It clears heat. So typically, typically in my clinic, I put poultices on the area for between 4 and 6, 7, 8 hours. So not for more than 8 hours at a time. And then we let it rest for a day, and then we apply again. Let it rest and apply again. Let it rest and apply again. If the patient really doesn't live close to you, you can actually send them home with some of the material, teach them how to make it themselves, and then have them wrap themselves once a day for about 6 hours, right? But then leave it off. If it's constant application, it can maybe cause an irritation. If kinesiotaping causes itching, you have to change the brand of kinesiotape, or some patients are just going to be too sensitive. So with the poultice, if it's on a limb like this, if the patient is sensitive to the adhesive on tape, you can use a self-adhering bandage. In the United States, it's sold under sometimes the product name Vet Wrap. So it's a bandage that doesn't stick to the skin, but sticks to itself. So you put the poultice down and wrap with the self-adhering bandage. Because some people, I've had more patients sensitive to the adhesives in the tape than in the poultice material itself, right? So that is a potential, which is another reason why if it's a first-time patient, you don't want to have them leave it on for too long. I'll see if I can bring some stuff from the, if we can bring some stuff from the United States. Yeah, so we use Moyao and Ruxiang commonly. One of the nice things, again, about topical application is that you're not going to have interaction, right? So if you use Danshen, use salvia root, if the patient's on a blood thinner internally, topical application is not going to interact with that medication. So you don't have to worry about that. Topicals are good. The reason they use, so if you look at Chinese medicine history, a lot of imperial physicians, we have the imperial case records from like the last couple of sovereigns of the Qing dynasty, lots of external herbs. And some scholars today believe they used lots of external herbs because it's harder to kill your patient with external herbs. And if you're working with the emperor or the empress dowager, you don't want them pissed off at you. So you would use mild yet effective, right? Mild yet effective treatments. So topicals can be fairly mild yet effective treatments. It's true. There were books, I can give you the citations. There's one of the books written in Chinese, and then one was translated into English. A collection of formulas from Cixi, the last Empress Dowager, and one of the emperors right around the same time. Lots of topical formulas they used, and the theory is that's why they probably used them. Okay, anything else or words from our sponsor?
No, thank you very much, Henry. And yeah, obviously, if anyone found anything that Henry covered today interesting, please do consider joining us in February. So yeah, we will be running those two workshops as two separate ones, but we do encourage you to come along to both. And yeah, I'm personally really excited to learn more of the external herbs because I think it's something that isn't really well taught. And I think there's so much potential for it, especially in like an acupuncture clinic. So
Yeah.
thank you, Henry, and thank you
Yep.
everyone for joining us. I'll send out an email at some point when I finish the editing and everything when you guys can review this recording. Otherwise, have a great rest of the day, and Henry, have a good evening.
Thank you. All right. Have a good evening, everyone, and hope to see many of you in February. We can go to the beach together after class. So I'm looking forward to that.
Sounds good. Sounds
All
good.
right.
Thanks.
Thanks. Bye bye.